the Medical AI Podcast.
Every year, in the beautiful cultural city of Vienna, there is a conference known as ECR, the European Congress of Radiology. This is a chance for the movers and shakers in medical imaging to get together to exchange ideas, make pitches, and launch new products. In recent years, AI has become more and more prominent at ECR to the point where it is now quite rare to find an exhibitor not talking about AI. I wanted to briefly sample some of the most interesting companies to give an overview of where medical AI is right now. What are people working on? What stage are companies at? How is it going? So here is a series of 10 short interviews, my highlights of ECR 2023. Many thanks to the contributors. In order, you'll hear from GE Healthcare, Koios, Siemens Healthineers, Qure.ai, Samsung, Esaote, Agfa, Canon, Carestream and Varex. Enjoy. Seda, a very big welcome. Could you just introduce yourself?
Of course, thank you, Felix. So I'm Seda, I'm the X-ray product marketing manager for GE Healthcare and for Europe, Middle East and Africa. I'm very happy to meet you here at ECR.
Thank you. Now, everyone will have heard of GE Healthcare, but a lot of people won't be fully clear on what GE Healthcare's involvement in medical imaging is. Could you just explain a little about that?
Of course. So GE Healthcare is a global, international leader in the medical sector. We mainly focus on diagnostic imaging. For instance, we offer MRI solutions, CT solutions, X-ray. We also do patient care solutions. So we kind of have a broad scope, and the core of our work is really around diagnostic imaging.
Now, GE Healthcare is in a unique position because it's a market leader. It has more FDA-approved medical AI systems than any other company. If, however, I asked you to pick out one AI application for medicine, what would that be?
Yes, sure. It will certainly be Critical Care Suite. It's our embedded AI solution that will help in identifying critical cases like pneumothorax and also prioritizing patients. It also features another algorithm that will help you with the endotracheal tube positioning, which is critical because if that particular action is not done the right way by the medical staff, it can really lead to serious complications. So that tool will help you really make sure that you're placing the ET tube right and avoiding any complication.
Now, the first thing you mentioned there was pneumothorax. Could you just explain what pneumothorax is?
Pneumothorax is actually a collapsed lung. This can be the result of a trauma or a lung disease. So it's a condition that we really need to detect as early as possible because it can be, something that is very critical and bad for the patient.
Let's say that somebody presents with pneumothorax. What are the kind of things that can go wrong with current conventional medical systems?
So I like that question. What I will do is I give you a practical example of what happened in one of the sites, where we're using Critical Care Suite. So they had a COVID patient, right? Very serious case. The patient was intubated. The physician went in to do the ET tube placement, and they missed out on the pneumothorax. Right on the spot, the image and the exam has been sent to the PACS and has been prioritized thanks to the CCS application, and the radiologist spotted the pneumothorax. So what they did is on the fly, they called back the physician for them to take action. In 15 minutes, a seriously ill patient that had COVID-19 has been treated, whereas they could be waiting for 8 hours. And this possibly saved their lives. So you can see how powerful AI can be, to really deliver better care.
I would say it's a classic kind of medical imaging AI system. And it's great to hear how it's being implemented in practice. So can you say something about how far it's being implemented in practice and what kind of problems have you had with the implementation?
So, First of all, when we developed it, we trained it on so many images, 12,000 images for pneumothorax, more than 30,000 images for the ET tube positioning. And we also went through, a lot of studies for FDA and CE marking. And I think if we have to talk about maybe the challenges we sort of had, when you have an innovation like this, you need to figure out a way to embed it into the workflow, the existing workflow. And many customers have different ways of working. They have different PACS systems. So we had to figure out a way to integrate it to every customer profile, whatever PACS they had. And that has been kind of complex, but it's something that we have successfully reached, and we're very happy about the results now.
What kind of feedback have you had from the people who actually use these kind of systems?
Tremendous, very positive feedback. It really gives you more clinical confidence. AI is not there to replace the radiologist, obviously. It will never replace the radiologist. It is really there to assist you, give you more clinical confidence. And it's also a great way to reduce reporting time. We've done studies with some of our customers, and it showed that how, significantly it could reduce the reporting time. As well, it increases the sensitivity. We worked with, for instance, the University Hospital of Oxford, and we had a study that showed that it increased the sensitivity up to 35%, which is incredible. And we also see value in this application, especially when it comes to junior radiologists. They are not confident enough yet. They need more experience. And this tool is really empowering them. And as well, it's not only used by radiologists, by the way, clinicians and any physician or any person that is actually at the bedside of the patient can, use the tool and feel like they're having an impact here and possibly saving the patient's life.
Seda, thank you so much for sparing the time, and good luck for the rest of the conference.
Thank you so much, Felix.
Chad, it's great to meet you. Could you please just introduce yourself?
Oh, Felix, it's a pleasure. Chad McLennan, Chief Executive Owl for Koios Medical.
Now, Chief Executive Owl is probably the best job title I've ever come across. Could you just explain what that means?
Absolutely, sure. I'm happy to. So, as we've kind of forged into this space of AI, the concept of information that drives intelligence is really designed to make physicians, even though they're incredibly wise, even smarter. So we build smart ultrasound, and it's the AI and the power of that data that creates the wisdom, and the owl is the wise owl. And the owl sees in the dark, and many radiologists are in dark reading rooms, and it's also a bird of prey. We catch cancer. So it really symbolizes our mission of early detection of cancer and the elimination of overtreatment.
I'd like to think if I wander around the conference for long enough, maybe I'll meet a chief executive pigeon. I don't know.
I hope not.
So your company is Koios. Could you just explain a little about that company?
Absolutely. So Koios, it comes from the Greek mythology. It's the Titan god of wisdom, hence the owl, foresight, and intellect. And we take data that we crowdsource from around the world. We have about 57 or 58 unique sites that are providing data. And that data comes in, and we build models to give physicians intelligent diagnosis in real time, at their fingertips. So it's a smart ultrasound that works across every make and model of manufacturer. It's available directly on the GE Logic series, on their automated breast ultrasound, and it provides a preliminary report that you can export and then edit and save and have the confidence that you have another set of eyes every image you look at that's there to make sure that you can do things safely, quickly, and accurately.
So could you say something about what your thoughts are on the future of ultrasound as a technology?
Ultrasound is it's the most ubiquitously available. It continues to get better and better in terms of the image quality. And then when you can overlay artificial intelligence on top of it, it's a technology that is the safest you can share with a patient. There's no radiation. It doesn't require any contrast injections. And from an accessibility perspective, it can be in the most sophisticated imaging center in the world, and it can be in one of the most remote parts of the world. So really, ultrasound as a modality is poised to really continue transforming and disrupting the delivery of care by using technology.
Now, you work with GE Healthcare. Is GE Healthcare the only company that uses your systems?
So our software was developed ubiquitously to be vendor agnostic. So we take in images, so we can analyze images from any make and model of system. We've developed it in partnership with GE to be right there at point of care in the exam room. Those images can also be analyzed across every make and model of manufacturer of PACS. So I say we're integrated from A to V, from Agfa to Visage, Carestream, Sectra, Centricity. So it's been a wonderful partnership. The industry has really embraced AI, so it can be used basically by any practitioner that's using any type of hardware for their image acquisition.
Now, if a radiologist were using your kind of system, could you just explain in practical terms how that would go?
So rather than if, I'll explain the when. It's currently used in 34 countries. Hundreds and hundreds of physicians daily are scanning patients using AI. And as they or a sonographer acquire that image, there's two real areas of variability in ultrasound. One is the operator variability, because you can make an image look just about like anything. And then there's the interpretation variability, right? So what we've done is eliminated the variability in interpretation. So when they're acquiring the image, they're trying to get the best possible image, they still need to figure out what that is, right? Is that cancer? Is that benign? Is that somewhere in between? And we assist with a highly accurate and in essentially real-time interpretation of that image to give them the confidence in their clinical decision, whether they let something go because it's benign, zero likelihood of malignancy, or if something's really problematic, or somewhere in between. So we're catching more cancers earlier, fewer interval cancers, which is a cancer that wasn't seen the first time, and fewer biopsies of normal tissue. We're seeing major reductions, so we're able to use the power of machine learning to do both, to catch cancer and catch benign and interpret benign accurately, so that physician can move on to the next patient, give that patient the peace of mind that there's nothing to worry about, or accelerate the treatment because you caught something early.
It's been an absolute pleasure, Chad. Enjoy the rest of the conference.
All right, thank you. Appreciate it.
Juan, it's very nice to meet you. Could you please introduce yourself?
Yeah, thank you for having me in this interview. And this is Juan. I'm leading ultrasound R&D and artificial intelligence team of Samsung Healthcare. And we started AI technology since 2012. And after that, we launched our first AI-based ultrasound breast screening solution in 2016. And after that, we implemented more than 20 applications for ultrasound AI solutions and digital radiography solutions together. And at the beginning, we tried to apply that technology to supply a clinical decision support. For example, classifying benign or malignant. That was our starting point. But later, we found that there is another important direction, which is to increase the productivity of the radiologist. So, for example, automatic detection, automatic measurement for saving the time from their repetitive tasks. So we also implemented those solutions for the images that they acquire from ultrasound devices. And recently, we upgraded our AI solution for working all those things in real time while they are scanning. It means that, for example, suppose that one need to find some suspicious lesions in breast while they are scanning, and some may miss something important, and our real-time scanning solution, a real-time detection solution for breast, which we are currently developing now, which not commercialized yet, but it's a proof of concept, which is demonstrated in our booth as of now. It can automatically detect the lesion while they are scanning. And for example, for another example, that nerve tract segmentation is very important solution for needle procedure radiologist, and it automatically detect where the nerve is in the ultrasound images. And in addition to the nerves, and it also detects the blood vessels and bone muscles together. It segments in real time for every frame of the images while they are scanning. So those kind of things were possible that we apply those AI technologies in our those AI technologies in our ultrasound machine. We are calling it on-device AI. On-device AI can analyze the real-time images from the machine, and then we can show the real-time immediate result from the machine to show the detected areas in breast or nerves, for example.
One, you're from Samsung. A lot of people will think of Samsung as a maker of consumer electronics like TVs and so forth. Could you say something about Samsung's involvement in medical imaging?
Yeah, that's a good question. Well, we are actually Samsung Electronics have lots of IT solutions, as you know. And for example, IT solutions, IT connectivity is also important issue in healthcare industry too. So we have some solutions for connecting between hospitals. Like for example, in remote places, there are some experts in ultrasound scan, and in this local area, there may be some less experienced users who does not have that kind of good skill in ultrasound scans, and we connect them to share these local images to the remote site where the expert is. And then even that is our SonoSync solution, which is supported by Samsung Electronics IT solution, and the remote expert can control the panel of the ultrasound machine so that they can see the appropriate standard plane, so that they can measure the right size or right diameter of the corresponding area. So we can connect remote and local area by the IT technology, so-called SonoSync. And then there is also one example. And from Samsung Electronics, we also have big displays like a 55-inch or QLED TV display. We optimize that monitor image quality of the TV display to show the better image of the ultrasound image on it. That is our solution for as well. And there is a projector solution called the Freestyle, and we adopt that technology to share our image on the ceiling or on the wall at any place that the radiologists want. So, for example, in the operation room, they can share those ultrasound images on the big screen, just with the Freestyle projector solutions. That's how we are combining the Samsung Electronics IT solutions into our medical area.
One, thank you so much for your time. Enjoy the rest of the conference.
Thank you very much for this interview.
So, Darren, could you please introduce yourself?
Good morning, Felix. Darren Stevens is my name, and I'm Senior Vice President and Commercial Head for UK and Europe with Qure.ai. Nice to meet you.
And could you introduce Qure.ai for people who don't know?
Yeah, so Qure essentially is a breakthrough AI solution provider. Essentially what we're trying to do is that we're helping to make healthcare more accessible and affordable for people worldwide. Our technology enhances imaging accuracy and improving healthcare outcomes with the assistance of machine-supported tools. So we're deployed in over 1,000 sites in 70 plus countries, helping thousands of professionals annually. And it's fantastic to be here at ECR to meet lots of old and new friends.
So when you say imaging, are you talking about a particular imaging modality?
So our technology can be used across X-ray, CT, and our core areas will be in the areas of kind of X-ray, CT head, CT chest. And when we actually look at the different suites that we can provide, we operate across disease areas as well. So we can provide a lot of solutions that really, really help in terms of early diagnosis, helping the clinician get the patient through their pathway, through to their treatment, and manage more effectively.
And could you just say briefly where you are as a company right now?
So we're a relatively young company. We're only about 6 years old, but we're on a very strong, aggressive growth trajectory. And when we actually look at our global operations at the moment, we're about 235 employees globally. We're an Indian-based company with headquarters in Mumbai, Bangalore, and we have a UK entity and a US entity as well. But we're excited about our next chapter as we grow. So part of our vision is expanding in the US, expanding in Europe, and we've a lot of work done in the UK already.
Okay, so that explains your strong Indian accent, right?
Very good, absolutely. So I think one of the nice things about our organisation is that we love to tell stories about our use cases, and being an Irish guy, we like to tell stories. So it's a great honour for me to talk about all of the fantastic use cases and stories the company has created and achieved to date, and how we can take that story further along on our growth, you know.
So let's imagine a patient who, I don't know, has been in a car crash, they need an X-ray on their chest. Could you explain to this person what benefit there would be for a hospital using your kind of system as opposed to what currently is typical?
Yeah, and look, just from a very basic perspective, so the patient is imaged, and ultimately what needs to happen is that a clinician needs to make a call on what they see on those images. Having our solutions along as a second pair of eyes to help them ensure that they don't miss anything that's of significance, to ensure that we get a quick report and a timely report for that patient through to their next pathway, because ultimately those images are going to dictate where that patient goes next within the pathway within the hospital. So this technology can bring great efficiencies to a system that's really under pressure. There's not enough radiologists globally, as we know. There's not enough radiographers. There's not enough of anything, really. So anything that we can do in terms of technology to create enhancements and augment that whole process is hugely powerful, and that's ultimately our aim. Get this technology in the hands of those that can benefit from the most, and ultimately benefit the patients that they're caring for.
Now, Darren, these kind of AI systems require a lot of data on which they have to be trained. Now, as a young company, how did you get your hands on those masses of data?
In terms of our data set, we're one of the largest data sets probably in the industry, and in terms of the algorithms that we're trained on millions of algorithms. That's important, actually, and it's linked to one of the things that we're most excited about talking about at ECR is our new EU MDR Class 2B certification. And that essentially positions Qure as one of the most comprehensively certified portfolios of AI-based detection devices for radiology in Europe. It affirms our commitment to meeting the highest standards of safety and effectiveness. And in order to qualify for Class 2B certification, not only have you to have an audit and a technical pass, but also a deep clinical review. And that clinical review essentially proves that we're well validated within Europe. And the higher the risk class, the higher the evidence that you need to provide. So we're very proud of that, and we've had an awful lot of conversation and engagement from the audience at ECR around that announcement for the conference.
Congratulations, Darren. Good luck with the rest of the conference.
Thank you. Thank you very much, Felix.
Ivan, it's very nice to meet you. Could you please just introduce yourself and your company?
Yes, I'm more than happy to do this. My name is Ivo Drieser. I'm working at Siemens Healthineers, and I'm part of the clinical marketing team of the department DNA, Digital and Automation.
And could you explain a little bit about what Siemens' involvement in medical imaging is?
Siemens is pretty known for the machines they build. MRI, CTs. They deliver great images with clinical benefits. Nowadays we see that data, digitalization are big drivers in healthcare. So what we also aim as a company is to enhance all the data, make it comprehensive and understandable for our users. We deliver outcomes for our customers, radiologists, other clinicians, so that they can better help the patients. And on the other hand, of course, we fulfill a complete pathway, so to say. We're also at the early parts of like the scheduling of the appointments for the patients, helping radiographers, making excellent scans without burning their resources, so to say. That because generally we want to make it as easy as possible, but have very comprehensive clinical outcomes.
Now, AI, of course, has lots of applications in medical imaging. What is the one AI-related idea that you would like to talk about right now?
We do have a family. It's called AI Red Companion. It's pretty obvious. It's a companion, a buddy, a friend of the radiologist, where we see that different products for different modalities are helping radiologists. In real life, for example, in the UK, there are almost 2,000 doctors missing this year, and we don't want to help them with automation. So AI is there to have a look at the images, CT images for chest CT, for example, and we do the work that was in the past done manually by a doctor. So we measure diameters of big vessels, we look for long lesions, measure them, and give all this assessed data into the doctor's hands without any click for him, so that the burden on his shoulders is reduced and he can really focus on his work.
And could you talk a little bit about why this is such an important idea?
The important idea is we see at hospitals that it takes time until a data set is reported. The longer you wait, the longer the patient needs to wait for his results as well. And of course, when you oversee findings without help of AI, you even cannot treat the patient properly. So there we definitely see the big benefit of helping doctors with extra pair of eyes in doing his work or her work in daily routine.
And you're seeing this through your direct experience in clinical practice, correct?
Yes, that's correct. An example, for example, in Munich, they had a look at the aorta assessments. They looked at the aorta. They did different measurements with different doctors and then compared all these outcomes with AI. And with the help of AI, they could reduce the inter-reader availability because everybody's using the same base made by AI, so to say. So they have a consistent quality of outcomes, and they also enhance the reading and reporting time by almost 60% because AI is doing all the work for them, and they only have to control it and check it.
Ivo, thank you so much. It's been a real pleasure talking to you.
Okay, you're welcome. It was a pleasure.
Hi, Eugenio. Could you please introduce yourself and your company?
Thanks, Felix. I'm Eugenio Biglieri. I'm the Chief Operating Officer for Esaote. Esaote is an Italian company, and I've been lucky because I worked in this company for 37 years. We are a very innovative company in dealing with MRI, dedicated MRI. Actually, we invented dedicated MRI. Ultrasound is our main business, and then also medical IT business.
So you must have seen an awful lot of changes in your time. Could you talk about what changes AI have meant to your company?
I would say that I saw a lot of changes, and actually AI is really in some way driving the company in the latest year. As everybody understood, AI can bring a lot of benefit, in particular to patients, I believe, and also to our doctors, our customers. So we are strongly investing in new AI technologies in particular to streamline the work of doctors, to provide what we call actually, for us, AI means actually augmented insight, and that means that we are bringing more information, so to help the doctor to better understand pathologies, to make better diagnosis, and in the end, benefiting the patients. That's the main point.
So could you give me one specific example of a product which is like that and how it works?
Okay. A specific example is very easy because we just launched a new premium ultrasound, Malab X90, in this conference. And Malab X90 comes with a lot of tools. One that is very easy to understand is our Eurofusion. So it's the capability that now is very, very important for prostate treatment or to biopsy prostate with images fusion from ultrasound and MRI together. So we have a tool that basically, thanks to AI, in a few seconds, you put together the MRI and the ultrasound real time, and you can perform a very important procedure for men like my age that it will help a lot of the people. So AI is really making a quite a long procedure running in a few seconds.
Would you say that this fusion of MRI and ultrasound is really cutting edge? How far is it deployed in practice out there at the moment?
I would say that this is really in the beginning because the radiology, the clinical community just embraced this approach in the recent, 1.5 year, couple of years. So now it's very, very important. Everybody is demanding for that, and we believe that with this technology we can really help a lot on this approach. So it's really starting.
Eugenio, thank you very much. Enjoy the rest of the conference.
Thank you very much, Felix, for coming to visiting us.
Stuart, it's a pleasure sitting down with you. Could you please introduce yourself?
Sure, pleasure to meet you. My name is Stuart Ferguson. I'm the European Director for Healthcare IT for Canon Medical Systems Europe.
And could you say a little something about how Canon is involved with medical imaging?
Sure, Canon is a market leader in medical imaging. We have a wide range of modalities. So we cover everything: CT, X-ray, MRI systems, interventional radiology systems, as well as a broad range of healthcare IT solutions.
This is the Medical AI podcast, Stuart, obviously. So what's your one big AI-related idea for this conference?
So for AI, we see AI really helping to increase the efficiency of the workflow, but at the same time also looking to increase the confidence in making clinical decisions as quickly as possible. And with that, we have the automation platform. It's really an AI-based platform. It's a zero-click platform, which means that we can go right from our leading scanning technology straight to clinical decision as quickly as possible. And that's of particular importance to emergency imaging. So, for example, stroke diagnosis, where it's important to be able to make the appropriate clinical decision as quickly as possible. We also have capabilities for triaging cases. So really, again, looking at productivity. So increasing the throughput of cases, making sure these are read as quickly as possible, but at the same time really looking to build clinical confidence to make sure all of the relevant information to allow doctors to be able to make an informed decision as quickly as possible is available at the right time, at the right place.
So let's imagine that somebody has been rushed into the to A&E and they have a suspected stroke. What happens to them next as far as their interaction with your kind of systems?
On arrival at the hospital, obviously the triage team would decide the effective path for the patient. They would typically go to be scanned using some of our leading modality scanners. The images from the scanners, the high-resolution images, would go directly to something like the automation platform. The automation platform would then determine the type of scan that had been sent to it, and based on the type of scan and what the automation platform determined in the scan, it would launch a number of AI algorithms, appropriate AI algorithms, looking for things like occlusion, hemorrhage detection. And then from that, the automation platform will automatically provide an overview of the results of the scan in an insights results, allowing doctors to quickly see the results and therefore make an informed decision on the best treatment path. So based on the information from the insights results report that we would provide, doctors and clinicians will be able to make the effective decision on how best to treat the patient. So that might be moving it from a regional hospital to the main hospital, so moving the patient to the appropriate place, or if they're already in the appropriate place, then the appropriate treatment path would be possible based on the evidence provided in the insights results.
Stuart, thank you so much. It's really appreciated.
You're very welcome. A pleasure to meet you.
So, Paul, could you please introduce yourself?
I'm a product manager for the software, the global product manager for software at Agfa Radiology Solutions.
And could you describe Agfa's involvement in medical imaging?
In medical imaging, the Agfa Radiology Solution division is focusing on supplying equipment, solutions actually, with X-ray, plain X-ray imaging equipment, including the software, the workstations that deliver good diagnosis quality images.
And could you say something about the one big idea that you'd like to communicate on medical AI for this conference?
Medical AI, for me, is going to improve how radiographers and radiologists work and will prevent human mistakes from happening, basically. These human mistakes can take place at point of care, or actually can be at improving how radiologists can see things that they could not before, and then replace and substitute to other modalities, actually.
Okay, so could you give us a specific example, maybe talk about the most common kind of mistakes that radiologists, who, as we know, are very overworked sometimes, what kind of mistakes are those, and how can your AI systems help address those?
Well, the positioning mistakes, which lead to repeats, and that's something that we can help by having AI directly embedded at point of care, so that the radiographer does not send sub-quality images in the PACS and archive that, so that the radiologist doesn't need to call after and that ask for patient repeats, actually.
Okay, so your systems detect when there's been a problem with acquisition and instruct the radiographer to, or at least suggest to the radiographer, there should be a repeated assessment, correct?
Exactly. Actually, we are not slowing down the workflow. We advise radiographers what they should do, and in case there is an issue, they will be just notified that they should do something different. But if they want, and if there is an emergency, they can still expose and then keep the productivity of the radiology departments high, actually.
Okay, got it. And also from the point of view of the patient, why is avoiding repeats important?
Well, each X-ray is actually exposing patient to higher dose. So in order to follow the guidance in actually, especially in Europe, in Germany, in the US, reducing the dose is a continuous improvement process that the radiology departments are focused on.
Now, you must be getting feedback from clinicians and radiographers using these kind of systems. What kind of feedback have you had?
Well, the feedback is that the processing, the image quality that we deliver at Agfa, which is the gold standard of the image quality, is good already. So if we improve it, we will improve several percentage of the patient exams diagnostic quality. However, if we prevent mistakes from happening at the insets when the acquisition is done, then we have a much larger impact in the number of exams that are successful or at least good quality for the radiologist to carry out his reporting with confidence.
Good. Well, Paul, thank you so much. It's been a pleasure meeting you. Good luck with the rest of the conference.
Thank you very much, Felix.
I am here with Luca Bogoni from Carestream. Luca, welcome. Would you like to just introduce yourself, please?
Oh, thank you. At Carestream, I lead the innovation. I'm head of advanced innovation.
Could you just briefly introduce Carestream?
Certainly. Carestream is one of the leading manufacturer of X-ray. It is worldwide. It's a rather large company with a strong presence around in 190 countries. Some of them we have some direct sales, others are indirects. In certain countries we have around 15% of the market share, and it's well known and as a brand for the quality of images, high quality of images.
And what is the one cool idea that you are most keen to get across this conference?
So the cool idea, I think that a big idea is transformative and impactful. And so at Carestream, we are applying AI to advance image quality to improve image interpretability at the end. And how do we do that? We do this in two ways. One is the acquisition end, impacting using workflow intelligence, and the other one is pertaining image quality. And we use that by applying image intelligence. From a workflow intelligence, what does that mean? Workflow intelligence means standardization of tasks and remove and automate some of the repetitive tasks, as well as optimize the workflow and the quality, and to provide some QC quality control at the end after image is acquired. And we're doing this in the workflows of the acquisitions. The benefit is that high quality images, as high quality images are acquired, there are fewer retakes, and there are in fact cases that could lead up to 30% retakes, possible studies, due to poor image quality. So we want to avoid that, less exposure, better patient and radiographer experience all around. From an imaging intelligence standpoint, we have AI that we have put as part of the whole acquisition process, so that, for instance, we can provide patient feedback to the radiographer once they position the patient in case they begin to move. So there is a real-time feedback through AI that can then that the radiographer can guide the patient to readjust, thus optimizing the acquisition. But image quality is not just about the acquisition process, it's also the suppression of noise, because inherently in the acquisition there is electrical noise, there is technique noise and other factors. So with that, we have one of the components, AI components that we have, is the smart noise cancellations. It's a process that uses deep learning to identify noise and actually subtract it from the images. That gives better, at the end of the whole process, we have images that are of higher quality, which then can impact the interpretability and lead to radiologists to be more confident and more effective in their diagnostic decisions.
Luca, thank you very much indeed. Enjoy the rest of the conference.
It was a pleasure. Thank you.
Jan, it's very nice to meet you. Would you like to introduce yourself, please?
Yes, thank you. Jan Wötz is my name. I'm the head of software product management for Varex Imaging and Mewis Medical Solutions, based in Salt Lake and in Germany. We are a provider of imaging components, for example, for CT systems, detectors, tubes, other hardware, and for dedicated software in that domain.
Now, could you explain the one big idea in medical AI that you would like to communicate for the conference?
Yes, we have a focus on lung cancer screening this year. We are the market leader in the domain, and we have a dedicated workstation that incorporates AI for detection of lung nodules, handling them over time, longitudinal analysis, and including malignancy probability estimation to support the whole workflow of the radiologist for efficient reading to the benefit of the patient.
And how far is this system being commercialized to date?
So we are in the market since 2004. So we were the first company who had a PMA on that with clearance in Europe and in the US. And recently we released a new version last year, which significantly improved the detection performance, adding additional nodule types. So a lot of companies do solid nodule detection. We do subsolid and malignancy probability and very efficient reporting with integration into the clinical infrastructure.
So this product is well established. What kind of evidence do you have to support its continuing use?
Yes, so we run clinical studies comparing ground truth expert radiologists giving the ground truth to readers and then compare that to their CAT performance. So we ran clinical studies in the US and in Europe that gave evidence that more than 26% of actionable nodules are actually missed by radiologists, which are found with the CAT support of the Esaote lung CAT system. So we really increase the quality of the reporting with an impact on malignant nodules as well.
So can you choose an example of how your AI system compares to the performance of radiologists in terms of accuracy?
Yes, there's bias. A radiologist is a human, and a human is sometimes distracted. For example, when the radiologist found a large nodule which is dominant, he does not, or sometimes occasionally does not look into other nodules that might be the more suspicious one that develop cancer in the long term. And these are typical Bay cases. If a radiologist worked for hours, then he might sometimes miss one, while a CAT is with the same performance whether it worked for 1 minute or for 10 hours. So that really increases the quality and reliability of continuous high quality reporting.
So do radiologists like you or dislike you in general?
They absolutely like us, so it's never about replacing a radiologist. That has been the buzz around for 3 years now. I think nobody really believes in it. AI or CAT is an assistant aiding the radiologist, taking standard daily work for him so that he can concentrate on the really important things. What about incidental findings, for example? If you're in a procedure to get a lung screening scan, what if you have emphysema, for example, as well, has to be detected, or a cardiac disease that has to be found as well. And if you don't give this problem to the eye, it will not look for it, or it's obvious for the human eye. So it's really about getting focus, let the radiologists do what they can do best, and let the standard things do the machine, because they are trained on that and perform standard tasks much more efficient and much more precisely.
Yeah, it's been an absolute pleasure meeting you. Good luck with the rest of the conference.
Yeah, thank you. Welcome, Felix.
Pleasure. Thank you for listening. This has been the Medical AI Podcast. I'm Felix Beecher. Ping me on LinkedIn for more information on Omdia's services in healthcare technology. See you next time.